We live in a society that glorifies sleeping when you're dead.
Person that doesn't sleep adequately or with good enough quality, they're going to suffer health consequences. Your risk of depression, anxiety, substance use increases substantially. Having curtailed sleep and insomnia together leads to a higher risk of cardiovascular problems like high blood pressure, obesity.
And from a cognitive perspective,
people feel more irritable, people feel more depressed compared to their usual selves when they have the good sleep.
Who's Michael and why should they care about what you talk about?
Dr. Michael Mack is a sleep medicine specialist and psychiatrist at the Centre for Addiction and Mental Health.
He also serves on the education committees of the Canadian Psychiatric Association and American Academy of Sleep Medicine, among many other designations.
What exactly is happening while we're asleep that makes it such a necessity?
The time when our brain activates the lymphatic system.
What exactly does that mean?
It's the system by which all the waste products of our brain get shuttled away.
I know there are people who take cannabis to help them sleep. What about alcohol?
Sleep is one of those things, if you try to force it, it never works out. We talked about the risks of sleeping too little, like 6 hours or less. We see some of the same health risks for people that sleep regularly 9 hours or more.
Why? We find it very interesting that the majority of you who watch and listen to this show aren't yet subscribed to our channels across Spotify, Apple, YouTube. It would mean the world to us if you can do us that small kindness. It allows us to continue to bring on amazing guests week after week and continue to provide you with amazing value and content. It's the only thing we'll ever ask of you. If you can hit that follow or subscribe button, it would mean the world to us. Thank you so much and enjoy the episode. This is why I'm really excited to have this conversation with you, because I have been on a sleep journey for a very long time now, just trying to understand how to better my sleep. And Dr. Michael Mack, welcome to Gent's Talk.
Hey, thank you for having me.
I want to start this off by just asking you, for those who just stumble into this conversation, who's Michael and why should they care about what you talk about?
Maybe they don't need to care about what I talk about. I work as a psychiatrist and sleep doctor at CAMH, Center for Addiction and Mental Health. Sleep health and its interface with mental health is my passion and my interest. So I'm lucky I found something that I really enjoy doing, so it doesn't feel like work. And, I want to get my message out there, which is sleep health is probably just as important as, having good diet and regular physical activity. I think it's that third pillar that ties everything together. And I think if people sleep better, they're going to have, better health and live better lives. And that's what I want to do. And, that's the message I want to get out there.
Yeah. So we live in a society that glorifies sleeping when you're dead. We were talking about this before we started recording. This idea that, sleep is the last thing on your list. You just get in the hours that you can whenever you get them. Irregular, sleep late, wake up early, do whatever you need to do. Because we prioritize our jobs, our work, our lives, obviously. And now with the advent of not the advent, but with the skyrocketing use of social media, more and more people are just staying online for longer and longer hours. Maybe we can start by flipping that narrative on its head. Why is sleep so important?
Sleep is a non-negotiable factor in life, right? We all have to sleep. We can all relate to having sleep and sleep problems. It's absolutely crucial to life and health. So we know that in newborns, they need tons and tons of sleep. If you have a kid, you'll know, right? And that has to do with growth of the body and growth of the brain. It's the time when our learning during the day gets consolidated. It's involved with muscle and bone repair and shuttling the waste products of our brain. So it's just an absolute crucial part of our lives. And we spend, roughly about a third of our lives in sleep. And to optimize that is a simple but great way to live healthily.
And what happens if we don't get proper sleep? What's the actual effects on the body, on the mind?
Yeah, if a person doesn't get enough sleep or gets low quality sleep, let's say because of behavior, like you mentioned, our prioritization of work and glorifying people that work so hard and there's a perception that people, if they don't sleep, or if they sleep too much or they want to take naps, that's being lazy, right? So That's not the case. Like a person that doesn't sleep adequately or with good enough quality, they're going to suffer health consequences. So the obvious mental health consequences, of which I'm very interested, if you have bad sleep, you're probably going to have bad mood. So your risk of depression, your risk of anxiety, substance use increases substantially if you have poor sleep and have lower sleep quality. And that relationship is probably bidirectional. It goes both ways. If you have depression, you're probably going to develop bad sleep, anxiety, vice versa, PTSD. If you have those conditions, you're more likely to have worse sleep. So, I think those are the obvious mental health relationships. And then, what we're learning more and more about is that having curtailed sleep and insomnia together leads to a higher risk of, cardiovascular problems like high blood pressure, obesity, so on and so forth. So it really just bleeds into all facets of health.
What do you say then to people who hear this and are living a lifestyle where sleep is more of a luxury than it is a necessity for them? Maybe they work night shifts, maybe they work irregular hours, their sleep is all over the place, maybe they're a student in university and they got to stay up late studying. Maybe we can talk about, what advice can you give those people?
Yeah, there's some of us, right, because of our obligations, whether it's work or through school or just by need, might not have the adequate opportunity to have good sleep. So for those folks, we have ideas, we have strategies to maximize and optimize your sleep within those confines, those restrictions. So you mentioned shift work as an example. We know that people that do shift work, not just working during daytime when it's light out and sleeping when it's dark out, but the opposite. We know that that's associated with substantial health concerns, like with an increased risk of certain types of cancers like colorectal cancer, again, obesity, diabetes, hypertension. But there's ways to, ameliorate the risks to the best of our ability, recognizing that in the long term, that's still not optimal, but there are ways to at least bring those risks to a minimum.
Like what?
Things like, strategic timing of light exposure. Light is the strongest factor that entrains our internal body clock. We all have an internal body clock that's approximately 24 hours in length. And there's bodily processes that make the most sense to be active during the daytime, right? So during the daytime when it's light out, like now, we're more alert than, let's say, when it's dark out. We probably have greater cardiovascular strength and better reaction time, because these are things that historically what would have been tied to our ability to survive. But it also plays a role in terms of our daily functioning in terms of work and school. And there's gonna be other things that make more sense to be active when it's dark out. So when we're working at the opposite of that, it's against natural circadian rhythms. Having light exposure at the right time can actually delay or advance our natural secretion of melatonin, which is the neurohormone that regulates our internal body clock. And if you shift it earlier, shift it later, then your time when you feel sleepy and when you feel alert is going to be changed. But also taking exogenous melatonin, so over-the-counter melatonin, and doing it in a strategic way. And then also having strategic blocking of light so that you allow yourself to sleep.
Which is why they say things like don't look at screens at least an hour before bed. And the concept of melatonin and taking that, over-the-counter type, I've been told, and you're the expert, so you're going to correct me here if I'm wrong, but I've been told that if you take too much melatonin or for too long of a prolonged period of time, your body will stop naturally producing it.
I don't know that that's the absolute case.
Okay.
We know that in certain folks, when they take over-the-counter exogenous melatonin by pill, that sometimes that can reset a person's internal body clock actually. But I'm not sure that there's evidence to say that it'll cause your natural secretion to go by the wayside. Okay. I think the main issue, though, about melatonin in Canada is that it's not prescription. So if it's not prescription, unfortunately, it doesn't come under as stringent of regulatory review and regulation. And what we see is that the melatonin that we can purchase over the counter is not necessarily the greatest, in terms of promised potency versus what is delivered. So on the label, it might say 1 or 3 or 5 or whatever number of milligrams, But there's a study done by some scientists at Guelph University in 2017, and they looked at 31 different over-the-counter melatonin supplements, and they analyzed them for how much was actually in the pills compared to what was on the label. And the difference was minus 84% to plus like 400 something percent.
Wow. So you could either be getting no melatonin or a ridiculous amount more than what you've actually signed up for.
Yeah, which is a big issue, right? Because then you really don't know what you're taking.
So what happens to the body if you are taking that much melatonin? Don't you just sleep better?
Not necessarily. So a lot of people think that melatonin is like a sleeping pill when it's mostly a chronobiologic agent. So it just shifts your internal body clock earlier or later, depending on the time that you take it. In people with like an internal body clock issue that causes insomnia, the most common one being what we call delayed sleep-wake phase disorder. Like you'll know that, like, you know, teenage people who are like who are still in high school, they have a tendency to sleep late and wake up late.
Yeah. And
we know that that's physiologic. Like even I was part of that group. Like,
so was I. I would go to bed at maybe 2 a.m. and then not get up until 1 o'clock the next day.
Yeah.
And I'd just be fine. And I was like, yeah, I'm good to go. Now I can't sleep past like 8 a.m.
Yeah. So you've noticed like the progression of that, which is like, you know, once you leave like, you know, your early adulthood, for almost everybody or most people, we have physiologic phase advance, meaning that our tendency to sleep late and wake up late goes away. Like it goes the opposite direction. Yeah. We slowly sleep earlier and earlier until you'll see people who are like 60, 65, 70, and they have phase advance now.
Yeah. My parents are like that. They don't sleep till late again.
Or they go to bed really early and wake up really early.
Yeah.
Usually like with, you know, like our grandparents or something like that.
Yeah, that's true.
Yeah.
So, okay, I want to let's take a step back here.
Mm-hmm.
We know that based on how you've described it, that sleep is important for recovery. So if, let's say, for fitness, it's good for recovery. If you're not feeling well, there's a reason why we sleep extra when we're sick or we have the flu. But what exactly is happening while we're asleep? What happens to the body? What happens to the mind that makes it such a necessity?
Yeah, that's a great question. So, you know, as we all know, when a person is asleep, it's a mostly hypo-aroused state. Like, you know, right now we're talking, we're alert, we have our eyes open, we can like process any information that comes our way. A person that's asleep is going to be necessarily more relaxed and less aroused compared to a person that's awake. And what ends up happening is that, you know, a person will go from wakefulness with their eyes closed to light sleep to deep sleep and then dream sleep. And every cycle is about 90 minutes. And then you start again from light sleep, deep sleep, and dream sleep. And people get, in general, 4 to 5 cycles of that over the course of a night. And what ends up happening is that in deep sleep or slow wave sleep or delta sleep, that's the time when the body releases growth hormone. So in our younger days, we're growing vertically. When we're done vertical growth, it's involved with muscle and bone repair. And it's also, we'd like to think, the time when our brain activates the lymphatic system, at least to the fullest extent. And the lymphatic system is a recent discovery. I think people really started talking about this in 2013, but it's the system by which all the waste products of our brain get shuttled away.
The waste?
Waste products.
Interesting. What's the waste products?
Metabolites, like things that, you know, we end up, our brain consumes during the daytime. Probably like, you know, metabolites of glucose and other things that need to be shuttled away. And probably some of those negative proteins that are associated with cognitive impairment, like the ones that we might see in people with dementias later on in life.
Right.
So preservation of that slow wave sleep and having enough of that seems to be really important to good physical and mental health and cognitive health. So that's the deep sleep. And then in REM sleep, it's actually a time when our brain is more excitable and you know, running at a speed that's close to as though if we're awake. They used to call it paradoxical sleep for that reason, except that your body's completely paralyzed. But you can move your eyes, and obviously your lungs are still working and your heart is still beating.
So rapid eye movement is why they call it that.
That's right.
Yeah.
It's associated with dreaming, and it has important functions. We like to think that it's involved with emotional regulation. So if you have had some sort of recent stress or, you know, things that make you feel depressed or, you know, like things that are traumatic, people will talk about having, let's say, recurrent dreams and maybe even nightmares. But it seems to be the brain's way of, taking away that emotional valency, that level of strong emotional reaction to certain events that allows us to control our emotions during the daytime. So if a person has impaired REM sleep, sometimes they're more irritable. And then moreover, we'd like to think that REM sleep is associated with procedural learning. So if you learn how to play a guitar, ride a bicycle, like that would be the time in sleep that kind of knowledge, new knowledge, gets consolidated. Whereas deep sleep or slow wave sleep, that's we like to think it's associated with declarative memory. So memorizing statistics, studying for exams.
Yeah. So is there one that's better than the other, deep sleep or REM sleep? Like if you had to try to achieve one, and I don't know quite how you would try to achieve it, it just sort of happens. Mm-hmm. But is there one that's better than the other?
I don't want to say that there's one that's better than the other. I think, all the stages of sleep exist for a reason. Otherwise, we wouldn't be having it.
Right.
So I think they're all crucial. Yeah.
Okay. So then when you talked about how people who don't get a good enough amount of sleep regularly, and we're talking quality, less than quantity, you said that it could lead to cardiovascular disease, cancer. How does one equate the other?
Yeah. And so, I do teaching about insomnia, right? And I show them slides that people with insomnia are much more likely to have neurological disease, pain disorders, hypertension, etc., than people without insomnia. So the question is, how does the bad sleep mediate the physical health conditions? A lot of studies have been done, particularly from the group from Penn State University, and in measuring people with insomnia, like a problem falling asleep and staying asleep or waking up too early, particularly those people that sleep fewer than 6 hours a night, we see that there's an inappropriate activation of your sympathetic nervous system. So like, the fight or flight system. And, that causes wear and tear directly to the cardiovascular system, and also causes, the increased risk of diabetes and stroke and heart attack and things like that.
So your body's basically working overtime just to sustain itself, but it's also more prone to these things because it just doesn't have the defenses to fight them off.
The bad sleep leads to inappropriate fight or flight,
right?
And that's like the unnecessary wear and tear to all sorts of parts of your body. Yeah. And
from a cognitive perspective, how does bad sleep affect your ability to function the next day?
Yeah, we know that in people with like arousals from sleep, so going from let's say a deeper stage of sleep to a lighter one, or even sometimes to full wakefulness, that those folks do worse in terms of cognitive testing, like short-term memory, reaction time, switching attention from one topic to another and going back. And they also tend to do worse in terms of mood outcomes. So people feel more irritable, people feel more depressed compared to their usual selves when they have the good sleep. Our brain keeps track of those types of awakenings, or going from deeper stages of sleep to lighter ones. And it's not obvious a lot of times it's not obvious to us when we're sleeping, but unfortunately it does confer those negative outcomes. So I've been tracking my sleep now since the beginning of this calendar year. And I've noticed that when I do have dreams, I feel significantly better the next day. More physically comfortable, alert. Mentally, I'm more focused and sharp. And I've noticed that difference versus nights where I've had really bad sleep, quality-wise, where I'm just sluggish, my mood is off. I'm a lot more emotional and a lot more irritable. Now, I've also noticed that I wake up several times a night. And sometimes I don't even know that I've woken up several times a night. Yeah. If you're a light sleeper, if you have a hard time falling asleep, staying asleep, what advice can you give those people? Yeah, like for a person with, let's say, sleep initiation maintenance problems, right? Like you mentioned, like a problem falling asleep or staying asleep. Those might be symptoms of insomnia. And it's a particularly big problem if you have those nighttime issues causing a daytime dysfunction, whether it's a problem with, work or with school or meeting your familial obligations. And if you have those symptoms causing a daytime issue for 3 times a week for 3 months, then that's a disorder that demands treatment. If you meet those criteria, then it's probably not going to go away on its own, and will cause the health issues that I mentioned, both mental health and physical. So in that scenario, we recommend people to enact good sleep hygiene if they haven't done so already. Like what? So sleep hygiene would be things like, and you may have heard of these already, like waking up, every day around the same time to prevent yourself from getting that social jet lag. Lots of people will, wake up earlier Monday to Friday because they have to get to work or school. And then on Saturday and Sunday, because they're, doing more things, they might wake up a little bit later and sleep in a little bit longer. But that difference between the Sunday night to Monday, that's a form of jet lag. And we know it takes about a 24-hour period to overcome 1 hour difference in terms of wake time. It's almost like jet lag when you travel across time zones. So waking up every day at the same time and then going to bed when you're feeling sleepy, keeping your sleeping quarters cool, dark, and quiet so that you can have an adequate opportunity to sleep well. Not using alcohol, nicotine, or any other substances close to your bedtime. And probably if you really want good sleep, you probably don't want to be doing any of that in the afternoon. But at a minimum, we would say 2 to 3 hours.
What about cannabis? I know there are people who take cannabis to help them sleep.
Yeah, that's a very timely question, right? Because we have the legalization of cannabis these days. So in the short term, there's been studies looking at different types of cannabinoids because it's not just, one substance in cannabis. We have THC, we have cannabidiol and cannabinol. And people have been studying this all over the world. And in the short term, it could help a person fall asleep quicker. But anytime they do long-term studies, let's say 6 weeks nightly use or longer, it actually has the opposite effect. It makes sleep worse in terms of your sleep quality, meaning you get less deep sleep, less dream sleep, more light sleep. And the time it takes for you to fall asleep increases, as does the time that you're up in the middle of the night. So for those reasons, I just wouldn't recommend cannabis use. Moreover, it's a risk factor in developing psychosis, like, hearing voices and having symptoms of schizophrenia. So
is that cannabis tied to sleep issues or just cannabis in isolation?
Cannabis by itself.
Interesting.
But for all these reasons above, I wouldn't recommend it. And if a person is going to use cannabis, then again, I would recommend no use, at least 2 to 3 hours close to your bedtime. But if you want the best sleep, I just wouldn't do it in the afternoon. And then same thing with exercise, right? Exercise is great for health and improves your sleep, but not too close to bedtime because it's probably going to amp you up.
Yeah, I found so part of this journey that I've been on of just sort of improving my fitness overall, I had been experimenting with working out at different times of the day. And I found that working out in the afternoon was optimal for me because then I didn't have that afternoon crash of feeling like, wow, that day just kicked my ass and now I'm just emotionally drained. But it also wasn't too close to bed where I was as soon as I got home, I was like, all right, I'm wired. I need to do something right now.
Yeah, I think that's a pretty optimal way to organize your day. Right.
So what about alcohol? We live in a society where, it's a social practice that's very commonly accepted, although we are starting to see a significant movement towards non-alcoholic options. It seems like every brand now offers a non-alcoholic version of their staple drink. But I'm curious what the effects of alcohol are on the body, particularly when it comes to sleep.
Yeah. Alcohol actually touches on the brain receptors that are inhibitory. So in the short term, when it's active in your body, it will actually induce sleep earlier. So we've all had the experience. We have dinner, we have a glass of wine or two, and then that night you might fall asleep very quickly. But as soon as your liver metabolizes the alcohol out of your body, then it has the opposite effect, meaning that it causes wakefulness. So you end up waking up in the middle of the night. It's 2:30 or 3, and then use the bathroom, and then you're up for a little bit. So that's the issue about alcohol, that when it's in you, it might lead to earlier sleep. But once it's out of you, which is almost always in the middle of the night, then you're up in the middle of the night.
What about, I've heard that alcohol can also suppress your ability to hit REM sleep.
That's absolutely true. It reduces deep sleep or slow wave sleep, and it reduces REM sleep. So if we do EEG, looking at your brain waves on the nights that a person is taking alcohol, it's not going to look like normal sleep. You're going to get less deep sleep and less REM sleep, as you mentioned.
So when you're, blackout drunk and you sleep through the whole night, what's happening to you there?
That person is probably having a lot of light sleep. And as you mentioned before, they might have actually some awakenings that, they're not privy to. They don't remember. And that sleep is not going to be restorative compared to, let's say, sleep on a regular night without alcohol. And it's for all those reasons that, again, I would not recommend using alcohol as like a sleep aid, which I know a lot of people do worldwide. It's like across all cultures, right?
Yeah.
But then you combine that with the fact that if a person drinks like every night, like for a prolonged period, you have tolerance to it.
Right.
And it's the same, it would be the same with certain sleeping medications that you have tolerance and addiction in the long term.
Well, I was going to ask you about sleeping pills in general. I know that there are some people who out there who are listening and watching this who've either used them, will be using them, are using them. Are there concerns or things people should be mindful of when they start, even if prescribed, that they should know about when it comes to sleeping pills?
Yeah, absolutely. So, I don't know of a single sleeping pill that doesn't have significant or potential side effects. The historic ones that are most widely prescribed are the Z drugs, the ones that start with Z. So things like zopiclone, ezopiclone, zolpidem, Zalopon. And what's funny about them, and they're one generation after benzodiazepines. You've heard of diazepam, clonazepam, lorazepam?
Yeah. I can't say I know exactly what they all represented, but those names are very familiar.
Yeah, those are medications that they historically used for like anxiety and sleep. And then before that, they had barbiturates, which you're a fan of Marty Scorsese's movies?
Yes.
Like Wolf of Wall Street and Goodfellas.
I see.
A lot of those characters, right, in that era, like the 70s and 80s, like when they were still prescribing barbiturates, those were the medications that were first generation.
Right.
And in all three, barbiturates, benzodiazepines, and Z drugs, they're what we call benzodiazepine receptor agonists. And they tickle the GABA receptors of our brain. So GABA is the main inhibitory pathway of our brain that allows us to, chill out, relax, sleep, have less anxiety, I guess. So the problem with that is alcohol also goes through that same pathway.
So the thing that's so the sleeping pills that are supposed to help you sleep better also impact your ability to like control your anxiety and your mood.
Some of them have like a shared pathway. So that's why the benzodiazepines, a lot of them had like dual actions. So like some of them were used as prescribed drugs for treating anxiety, and then they could also be used in the treatment of sleep, like insomnia. The third generation, the Z drugs, less so. They're only indicated for sleep issues. But the issue is that they all have the common problem, which is if you take them for a prolonged period, that your body's going to get used to them. And then for some people, it means taking a higher and higher dose to achieve the same effect. In other cases, they just stop working.
So why do we prescribe them?
It's a big problem. Like when we think about insomnia, it affects like a substantial portion of the population.
How many people struggle with insomnia?
In Canada, the latest statistics are 16.3%. And that's under the strictest criteria. So a problem at nighttime, leading to daytime dysfunction 3 times a week for 3 months. If you're just asking a random person in the street, do you have sleep problems or are you dissatisfied with your sleep? That's about 24%.
Wow. And what about globally?
Globally, the numbers that we quote, 6 to 10%. So Canada actually has more insomnia complaints and insomnia disorder compared to the worldwide average.
What about the U.S.?
U.S. is I think a little bit lower than Canada. So
really,
yeah, for them they're still quoting around 10%.
But that's 10% of like 300 million versus 16% of 30.
Yeah, it's a huge proportion. We're not talking about an issue that affects 1 in 100 people. This is much harder than that, and that's why I think it deserves more attention.
Okay, so I want to ask you about the insomnia piece here. How does insomnia even start? How does that happen? Because I've talked to people who are like, yeah, I struggle with insomnia, and I probe, and they don't quite know for sure that they struggle with insomnia. They just go, I have bad sleep. Well, like, what does that mean? So maybe we can start by clearly defining what insomnia is, so that anybody who's listening or watching this can at least be able to say, yeah, I have that, or no, maybe I don't have that.
Yeah. So the definition of insomnia disorder, where it demands treatment, where it's likely not going to go away and confers health concerns. You have a problem falling asleep, staying asleep, or waking up too early, despite adequate sleep opportunity, right? Having like a private area that's cool, dark, and quiet. and it's got to cause daytime dysfunction. Because if your nighttime symptoms don't cause you daytime problems, then it's not really a disorder. And then we always have a duration criteria for conditions. So symptoms being present for 3 times a week for 3 months. And if you meet that criteria, then you should probably ask for professional help and get treatment for that.
But then it seems like, or sounds like, the treatment and professional help is going to be a prescription of some kind that's not exactly going to help them in the long term.
The medication piece would be a second line treatment. Our first treatment that we recommend to everybody is actually it's a psychological approach. It's a therapy called cognitive behavioral therapy for insomnia.
Okay.
And it's the absolute best treatment for insomnia. So
why?
It's a time-limited type of therapy.
How does it work?
Generally speaking, it's like 4 to 12 sessions in length. You meet with, and you can meet with a therapist to do it, one-on-one. You can do it through groups. You can read the textbook for it, or read self-help books that tell you about the principle of this therapy. You can use internet-guided versions of this therapy, or do it through your smartphone app. And it works equally as well, if not better, than any sleeping pill. And the greatest part about it is the gains are durable, meaning that when you complete the course, the insomnia goes away and it tends not to come back because your approach to sleep has changed. So that's actually like the top treatment that we recommend to people.
So what exactly is happening in the treatment that's teaching people how to overcome their own insomnia?
Yeah. So first off, when people think about psychological or behavioral ways to treat insomnia, to think of sleep hygiene, which we talked about earlier.
Yeah.
So when we study people that meet that full criteria, sleep hygiene by itself hasn't been shown to be helpful in treating insomnia disorder if you meet the full criteria. It's one of 5 components of cognitive behavioral therapy for insomnia. You have sleep hygiene, but additional to that, you have other principles. So namely sleep restriction, stimulus control, cognitive restructuring, and relaxation-based therapy. The five factors together combine to form cognitive behavioral therapy for insomnia. So that has been shown to be the most effective and enduring treatment for insomnia.
Is there, when it comes to sleeping issues and what results from poor sleep quality, is there a difference in how it affects men versus women?
Yeah. There are significant gender differences in terms of how insomnia affects people. We know that insomnia disproportionately affects females compared to men. The risk is about, for ladies, it's an increased risk of about 58%. Yeah.
Wow.
Yeah.
So poor sleep, you're talking about all those other, like cardiovascular potential for cancer, diabetes, all those things.
That increased risk is for having insomnia, but then having insomnia then confers those.
So it's the insomnia that can trigger all those other things.
Yeah, it's one of the reasons why people will have greater risk of those conditions, for sure.
What if you're a pregnant woman?
We do see insomnia in pregnant ladies, and moms will tell you that during when they're carrying their baby, it is a physically demanding time. And for those reasons, this sleep during pregnancy may be necessarily lower quality compared to when the person has given, before they got pregnant, or a couple of years after the kid has grown up and is able to sleep through the night. But we don't think that kind of negative sleep, or that temporarily worse sleep, is going to confer any long-term health consequences.
And speaking of, when a kid is born, in that window of time where the kid's not sleeping, throughout the night, they're waking up several times a night, and as the parents you're getting up, that's obviously messing up your sleep. Then you got to go to work. What advice can you give those parents? Time
is your friend. That eventually, your baby will become a little person, and then they'll be able to sleep through the night, and you'll be able to sleep through the night. But I think that's when having a partner, having that partnership really helps. Sharing responsibilities in terms of let's say if the baby cries in the middle of the night, and feeding as appropriate, and to one's desires. But keeping healthy sleep principles themselves, like the parents, and which is what I mentioned, waking up every day around the same time, keeping your sleeping quarters cool, dark and quiet, and avoiding alcohol, etc.
How does poor sleep affect children? Like as they're growing up, let's say they have a hard time falling asleep, staying asleep, how does it affect them?
It can affect them in a serious way. So we know that the young people that have like the worst sleep, they tend to do worse in school. So their cognitive abilities are impacted. And, if that continues, that can affect like the trajectory of a person's life in a really negative way, right? Like it may mean the difference between, going to this school, going to that school, doing this job or that job. So we know that a lot of young kids actually with lower quality sleep, particularly if it's caused by, let's say, sleep apnea, it can actually mimic the symptoms of ADHD. So, we know that young people, if they're fidgety, if they have hyperactivity or an inattention at school, they run into problems. Whether, they get dinged for, behavioral outbursts or not doing well in school. And a lot of this can be traced to sleep issues. So, having that accurate diagnosis and treating whatever the condition is may impact a young person's life in a very positive way.
Should we be putting our children in school? Like, should they be starting school as early as they currently do? Not age-wise, but time-wise in the morning.
Yeah, it's something that I feel, a strong passion about, okay? Like in high school, at the very least, I would advocate for a later start time to match like, teenagers like internal body clocks so that they can actually do the best they can at the right time.
Right.
Like I remember when I was going to high school, like when I was in high school, homeroom was 8:30. And like I looked around, like I would get there, and myself included, I would look around. Most people are like still trying to like, putting their head on their desk. Yeah. Simply put, like we're fighting nature physiologically. Like they're not at their best. Like, it would be better if we started school later for teenagers.
What time?
I would delay it by about 3 hours. I think that matches up. Yep.
So like a start time of like 11:30.
Yeah, for like serious classes. Yeah.
Okay.
So, but advocacy is one thing, but then the problem is like, how practically it's received.
Yeah, right. Like you're talking about changing an entire education system built around putting kids in school so that parents can, be at work by a certain time.
Yeah. The first person they're upset are the parents, and then the second are the drivers.
Yeah.
Yeah.
Yeah, no, I totally get it. I heard that again, please correct this if it's wrong. I heard this on a podcast somewhere. It was, I believe, Matthew Walker talking about it, where he said that for guys specifically, if you get less than 6 quality hours of sleep a night on average, your testosterone level is that of someone 10 years your senior.
I think that I've seen studies that look at that and say that that's true.
So what exactly does that mean for men?
I think for men and women, optimal sleep is going to be more than 6 hours a night. Obviously, it's the shape of a bell curve in terms of like what's recommended. So by the way, the National Sleep Foundation and from all sources, essentially, we recommend for adults like 18 to 64 to sleep 7 to 9 hours. If you're above 65, then 7 to 8 hours. It's a bell curve in terms of, how many people in the population will achieve that kind of sleep. So, if we take the mean, it's probably maybe somewhere around 8 hours. You're going to have some people to the left that sleep fewer than that, and some people to the right that need more. But in general, when we look at the studies and how that sleep duration equates to health risks, sleeping fewer than 6 hours is just a bad thing. So leads to lower testosterone, as you mentioned, causes higher risk of hypertension, high blood pressure, higher risk of obesity, because that curtailed sleep affects our body's natural secretion of leptin, which tells us to stop eating, and ghrelin, which is the signal to be hungry. And even cardiovascular risks like heart attack. So there's been a number of studies that look into people with insomnia disorder and shorter sleep duration. People that sleep like 5 or 6 hours versus the people that sleep 8 hours, there's substantially increased risk of heart attacks compared to the people that slept to 8.
What about dementia, Alzheimer's, particularly in older folks?
Yeah. So right now we see an associative relationship between sleep disturbance earlier on in life, just general complaints of sleep not being good quality, and that can include, not sleeping enough, and having taken, asking for sleeping pills, and maybe like an increased risk of dementias later on in life. It's not causative, right? We don't know if it's, not sleeping enough that led to the dementia, or if, there were other factors like sleeping medications, etc. But there is an association there. And the question that needs to be answered is it that the group of people that eventually develop dementia, like that they have sleep complaints, or is it the sleep complaints that lead to the dementia?
Right. You're unable to identify which route it's gone.
Not yet, but I think a lot of work is going into elucidating that.
You mentioned obesity, and I want to talk about that because that's a growing and prevalent problem in our society globally, not just in Canada. How much of a role does sleep play into that?
The overlap between sleep and obesity is huge. So we've been talking a lot about insomnia as an example. And I mentioned that if you have insomnia, you don't sleep a long enough duration. If you're sleeping 6 hours or less, you're more likely to develop obesity. You're more likely to have worse blood sugars, which may mean diabetes. It may mean that you have high blood pressure. The other thing is that a person who's overweight or obese will also have lower sleep quality, just on the virtue of those conditions.
How come?
When they've studied people with obesity and overweight, they've seen greater middle night awakenings, taking longer time to fall asleep. And then when you ask those people if they have good sleep, more of them will say no. And it might be associated with the fact that having overweight or obesity is associated with a greater risk of sleep apnea, which is now a huge epidemic alongside obesity. So, there was a study looking at prevalence of sleep apnea worldwide from not too long ago. And for a person that holds their breath 5 times an hour, 5 times or more per hour, which is the definition of mild sleep apnea, that affects 936 million people worldwide. That's close to 1 billion people. So sleep apnea is a big reason why people have low sleep quality. They have less time in deep sleep. They have less time in dream sleep. They have more, again, high blood pressure, more diabetes, heart attack and stroke, all cause death. So I think that there's that big interplay between, obesity, bad sleep, and sleep apnea.
There's going to be people who are watching this, listening to this, who say to themselves, like, this all sounds very scary, but I'm not an insomniac. I'm relatively healthy. This doesn't really affect me. Yeah, sure, I have some bad sleep, but it's not really affecting me. What's the incentive for those people to further dedicate intention to improving their sleep?
Yeah, there's sleep for health reasons, and it's anything you do to improve your sleep will improve your overall health. I think optimizing sleep is also a way to optimize one's cognitive performance, athletic performance. So you might have heard about this already, but like LeBron James sleeps like 12 hours like a day.
I didn't know that. 12?
Yeah.
I know that professional athletes take a lot of naps.
Yeah.
Like midday naps. And I want to ask you about that in a moment. But 12 hours is, how does he even stay asleep that long?
Yeah. I think it has to do with the fact that he's like, he's doing a lot of physical output.
Right. Yeah.
Lots of different, lots of training. And if you train a lot, necessarily so, you need to have like a rest period.
Right.
And the rest period is not just sitting around and relaxing, right? Sleep is the primary way to prevent overtraining. It's in whatever you do in the gym, how that converts to like an athletic improvement or like an improvement in performance occurs in your sleep. That's when your muscles and bones are getting stronger than they were prior to this workout. That's when the growth hormone that you naturally secrete, improves your physical structure. So, for professional athletes, they necessarily have to have longer periods of sleep. And this is where I think modern training intersects with sleep. More trainers now are attuned to the fact that if you're doing tons and tons of cardio and weightlifting, but you don't have, that associated increase in sleep, then you're at risk of overtraining and injuries. Yeah.
I think it was also Matthew Walker who said sleep is the body's natural steroid. And it rings so true as you're talking, because I'm thinking about just the recovery process. And you're right, it's not just sitting in a chair. It's your body has to be sort of in that deep rest mode for it to actually start doing what it needs to do. I also heard, I think it was Andrew Huberman talk about non-sleep deep rest, where you're kind of just laying in bed. You're not necessarily asleep, but your body is pretty much almost getting there, and that window of time also helps your body recover. Is there any validity to that?
I think, years ago, people were looking into how, like, when we try to sleep, and when we enter sleep, there's different types of brain waves that we have. And when we're awake right now with our eyes open, we have more beta brain waves, which are very, very fast. If we're lying down and like resting with our eyes closed, they're called alpha waves. Mm-hmm. So you're awake with your eyes closed, but maybe getting drowsy, maybe entering a state of rest. And then there's different brain waves associated with the different stages of sleep. But, I think people looked into whether there was like an advantage to have like a lot of alpha brain waves during the day as a form of rest. And I can't say that it's showing like, let's say, an advantage in terms of cognitive abilities. I think, the focus has been what happens after you've achieved sleep.
Can naps be used as a mechanism to make up for whatever sleep you didn't get the night prior?
It can. And the way to do it is you have to do it in a strategic way in terms of duration and timing. For older folks, I mentioned that like people who are 65 and above, the National Sleep Foundation says they recommend 7 to 8 hours. And you'll notice that's 1 hour less than, adults 18 to 64. And it's because, unfortunately, with aging, as with other bodily functions, we do have a deterioration in our ability to initiate and sustain sleep, more so sustaining sleep. A lot of older folks will wake up in the middle of the night. Sometimes,
which is interesting because you would suspect that they would need the extra sleep to maintain their body as it's starting to like get more fragile.
You're right, and maybe it's that loss of that ability to have that the restorative stage of sleep and aging,
which is leading to the fragility.
Yeah.
Okay.
And I think a lot of work is looking into like, is there a way to delay that? Mm-hmm. Some people's work has to do with somehow at least prolonging to our body's ability to stay in deep sleep, to remove all the reasons why a person's going to spend less time in deep sleep. And other people focus on other stages of sleep. But that's something that people are looking into as a means to improve health, but also maybe, improve longevity. Yeah.
The naps themselves, I've never been able to nap. It's never been anything I could do. I've tried. I mean, there's been a handful of times in my life where I've napped, and that's because I was sick. Is there a technique that you can recommend? Like this comes down to, I've somehow managed to, not somehow, I know how, but I've managed to regulate my sleep where I go to bed at a certain time. I know the conditions I need to set: dark room, colder temperature, no lights, no sounds, none of that. But in the middle of the day, knowing that napping is still a form of sleep that can help your body recover, it's a lot harder to produce those conditions.
Yeah.
Is there a technique that you could recommend?
Here's what I'll say. If you don't have to nap, then don't nap.
Okay, so don't force it.
Don't force it. Yeah, there's no point forcing it. Sleep is one of those things, if you try to force it, it never works out. So it's not so much like, creating like a method to induce naps, like for a person that doesn't need it, like yourself. I think you have probably optimal sleeping patterns. Like, you sleep at nighttime when you have to, and you wake up at the right time.
Right.
The napping is for the people that have to do it. So the reason why I brought up folks who are elderly is because they lose that ability to stay asleep in the middle of the night. So for some older folks, the way that they achieve the 7 or 8 recommended hours is to have some daytime naps, which leads into like, what's the right time to have a nap? So you don't want to have it too close to your bedtime. Then you're going to have insomnia.
Yeah.
So you might choose to do it. You might line it up with that circadian drop. After lunch, everybody has had that experience of like, feeling that, drop in alertness. Some cultures in the past have actually enshrined that as part of like a siesta.
But that's also because the meals they're having are so heavy.
I think the meals can make you feel sleepy, but there's also a natural circadian drop in alertness that's built into our DNA.
I see.
Yeah,
Okay.
there is like you take like 1,000 people and then you measure alertness at different times of the day. There is going to be that drop in the early afternoon, and you might choose to align that nap around that time, because then it's the it's sort of the circumstances that allow you to nap, and then you keep your naps quite short, 20 to 30 minutes at the very long, like in terms of length. That's it, not longer than that. Because that allows you to have restorative, like you'll feel restored when you wake up, but you're not going to wake up from a very deep sleep where your brain waves are actually very, very slow, and it's going to take some time for you to come up to full speed.
Hence that groggy feeling whenever you've had like a 2-3 hour nap sometimes.
Yeah, like you wake up and you're like, where am I?
What day is it?
yeah. Is it the next day? You get kind of worried.
Can you reset your circadian rhythm? Like if you're someone that's like, okay, listen, I really want to fix my sleep. I'm going to go to bed tonight at 9:30, 10 o'clock. Doesn't mean you have to sleep. Relax. Just means you start the process of it. But you're just like laying there for 2 hours wide awake. It's just not part of your regular routine. You want to reset the whole thing. How do you do that?
Yeah, you can reset your internal body clock. And I mentioned that light is the strongest factor that entrains our internal body clock. So strategic exposure to bright light. And when I say bright light, so the most obvious thing would be sunlight. Mm-hmm. And in lieu of that, in the winter months when it's really gloomy, like those devices that people use for seasonal depression?
Yep.
Bright light therapy lamps.
Yep.
They have a brightness of 10,000 lux. If you get a light like that, you can actually shift your internal body clock as you wish, which is helpful for shift work and people with jet lag and people with internal body clock issues. So I'll give you an example. We talked about the teenagers that sleep late and wake up late.
Yeah.
The biggest issue with that is that if, generally speaking, for the general public, we outgrow that with time. But there are people that don't outgrow that, and they always have that internal body clock that tells them to go to sleep at 2 or 3 o'clock in the morning and wake up at 1 p.m. Mm-hmm. For those folks to shift their internal body clock earlier, you want to sleep earlier and wake up earlier, then it's bright light exposure first thing upon awakening. That will shift your internal body clock earlier.
Yeah.
So
go look outside.
Yeah, open your blinds, go outside, turn on the lamp.
What if you said, the winter months, we're here in Toronto, the weather has sucked for the last few months, and, I think we just started seeing the sun.
Yeah.
In those middle months where, even I had noticed, I felt noticeably different in the mornings. Like I'd wake up and I was like, I just don't have the energy to get up. It's gloomy outside. It's gray. It's ugly. Outside of the lamps, what else can people do? Or is that even enough? Is that still fine?
I don't think let's say you have no lamps and no sun. I don't know that everyone's lighting in their homes will meet like that minimal criteria that allows the special receptors in your eyes to shift your internal body clock. Okay. There's special what they call melanopsin receptors that are independent from the ones that allow us to see color and light that entrain our internal body clock. So there's like a minimum brightness and a certain type of wavelength that's required. So you definitely do meet that with the SAD lamps that people use. Mm-hmm. So I would recommend that. Okay. Like if there's no possibility of natural lighting, to expose yourself to that SAD lamp for 30 minutes, first thing upon awakening. And you're going to see that shift of your sleepiness earlier. And then there's the opposite. If you need to delay your wake time, if you're working a night shift, for the people that work at Canada Post or they're nurses or they're in transportation.
Paramedics, all those people, yeah.
Absolutely. To when they're trying to work when it's dark out and sleep when it's light out, you want light exposure close to when your bedtime is, like to delay that secretion of melatonin that tells you when you should be feeling sleepy. Right. So bright light at night for those folks.
Is there anything that I haven't asked you about relative to sleep that you think is really important that people know about it? I don't think people take it seriously enough.
I think that's a big issue, and that's that's the message that we want to get out there. With at the hospital, with teaching at the university, and our work at the Canadian Sleep Society, we want people to understand that having good sleep means good overall health, and all the issues that we've talked about today, all the problems have treatments, and people get better. So if you have bad sleep, you have disturbed sleep, get professional help. Maybe some things that we have, that I might touch on a little bit more. We talked about insomnia and when you should ask for, help from your doctor. If a person snores regularly, they have daytime sleepiness, or you've been diagnosed with a new high blood pressure recently, you might be at risk of having sleep apnea.
What is snoring signal?
Snoring is the result of air going through the passages of your airways.
Yeah.
They're not completely closed, but they're causing turbulence because there's some like reduction of like the airflow.
Right.
So that noise is a signal that you might have sleep apnea. Sleep apnea referring to a complete closure of the airways. And if it happens enough at nighttime, then it causes sleepiness and fatigue, problems with memory and concentration, depression, high blood pressure, diabetes, heart attack, and stroke.
Wow. My partner has told me that on nights if I've had a day where I'm exhausted, I might snore a little bit, but for the most part I don't. And so I found it interesting that it only happens when I'm physically exhausted. What's the correlation there?
When a person is very, very physically fatigued and tired, like the muscles that line our airways might also be fatigued and become floppier. And as a consequence, gravity will just make them closed. Yeah.
Michael, thank you so much.
Yeah, thank you for having me.
This was, I was a big believer and proponent of sleeping better, not just sleeping more because, well, you know what, let me ask you this final question here. Sleep more or sleep better?
Sleep better. There's such thing as sleeping too much.
Okay, tell me.
Yeah, like we talked about the risks of sleeping too little, like 6 hours or less. We see some of the same health risks for people that sleep regularly 9 hours or more.
Why?
They're probably not expending enough, calories during the day. Maybe they're not active enough, right?
Because
for a
most of their
24-hour
time they're asleep.
Yeah, and the long sleep duration might be a sign that they have other health conditions. Okay. That lead to worse health outcomes. As an example, some people with depression, they feel so tired that they need more sleep. Physical, like a lot of physical health concerns cause fatigue also.
So if you find yourself as one of those people that sleeps, you said like 9 hours or longer as an adult, you should try to be regulating that down, like try to get yourself up a little bit earlier than that.
I'd be curious if it's associated with like a sleep disorder. So in that scenario, I'd probably ask for a referral from your family doctor to see a sleep specialist. Just get that sorted. Make sure that you're not sleeping too long because of a health concern or a sleep disorder. And if it's not because of that, and you're one of those people that need naturally more sleep, then so be it. But just to make sure it's not associated with a health problem.
Well, I mean, not all of us are LeBron James, who 12 hours is warranted.
Yeah.
I think the biggest thing I'm taking away from this conversation is that most, if not all, of these sleep issues are solvable and not by way of medication, which I think is the big one. I know when I've had trouble sleeping, I've thought about like, hey, why don't I just take something? And the most I've dabbled in has been melatonin. And that helps put me to sleep. But even on the bottle, it says you shouldn't be taking more than, X amount. Otherwise, you should see a doctor if you're having a hard time sleeping. But I think it's important for people to understand that you can see specialists and get treatment for it and course correct your sleep without having to rely on these prescription pills that we know have side effects. Like, I know as a doctor, you can only say certain things, but as a consumer, I'm happy to say that, yes, they have side effects. And I think we need to be very cognizant of those.
Absolutely. Like, I'm a big proponent of those behavioral, like the cognitive behavioral therapy for insomnia. It's the best treatment. And, if you access it, you can solve your issues without having to take a pill.
Amazing. Michael, thank you so much. I appreciate your time. I appreciate this insight. Thank you for the work that you're doing. It's super important. I hope you're able to help more people sleep. I hope your sleep is good. How is your sleep, by the way?
I sleep like a baby. But because of my body habitus right now, I have bad snoring and sleep apnea, but we're working on that.
Okay, very good. Well, I'm going to follow up with you in a couple of months and see how that's going.
I'll ask for you some tips about the workouts and whatnot.
I will. Michael, thank you so much. I appreciate it.
Thank you for having me.
Thank you, everybody.